throughout the U.S. There's probably many more now, but I'd say it's a pretty high number to begin with. There are probably 41 million at that time pre-diabetics, and I'm sure there aren't less now. So that is an enormous amount of people that are walking around with metabolic problems that could potentially lead to diabetes. Large burden. A large burden not only for the healthcare system, but it's a large burden for the individual who doesn't feel right day to day. And it's a large burden if you can't get to work. Because obviously if we don't work, there are no revenues, there are no taxes, there's no ability to pay for things. So I think this particular problem is going to become an economic issue as it is now, actually, to a great extent. 5 million people at that time are walking around as full diabetics with no idea why they're feeling so lousy. Now, why is that? Oftentimes, I think it's because they don't have access to health care. As we saw in the charts that Dr. Garcia showed, Salvandale has a very low percentage of detected diabetes. I think it's more because, obviously, as you said, there are access questions and problems. That accounts for some of these undiagnosed cases. Now, the more troubling thing that was seen in the NHANES 3 is we're seeing more and more children being diagnosed as type 2 adult onset. Okay, by definition, that particular disease should only be seen in adults, ergo the term adult onset. It's very troubling when you see young children beginning to develop type 2 diabetes, adult onset. It basically is telling you we're falling into a major crisis tending to a catastrophe if we don't start to do something. All right, so that's a general